Hello, my name is Dr. Madeleine Leininger. I am a nursing theorist. I began my nursing career as a member of the Cadet Nurse Corps, which was a training program for World War II. I continued my education over the next 20 years, earning my doctorate in 1966. My cultural competent care model first came about in my care of pediatric populations. It was through my observations that I realized that recurrent behavioral patterns in children seemed to have a cultural basis. A few years later, I took a trip to New Guinea, which opened my eyes to the need for culturally competent care. It was upon my return to the United States that I became the founder of the transcultural nursing theory. What is the transcultural nursing care theory and ethno-nursing? It is a middle-range theory, as it has particular dimensions to assess for a total picture. Its holistic and comprehensive approach leads to broader nursing applications than a traditional mid-range theory. And I have been historically known to deny it as a grand theory, as this theory addresses cultural dynamics, but it ultimately affects the nurse-client relationship. It offers a bridge between grand theories and nursing practice. It is simple, straightforward, and general. Some key components of the transcultural theory is that it states all cultures are not alike, and therefore each person should be respected for their differences. It requires nurses to provide culturally competent care, which combines culturally congruent behavior, practice attitudes, and policies that allow nurses to work effectively in cross-culturally situations. Health and care behaviors vary among cultures, and therefore they should be respected. And therefore nursing care cannot be determined through superficial knowledge. Rather, nursing care must be based on knowledge by examining social structure, worldview, cultural values, language, and environmental contexts. This is expressed and depicted through the sunrise model, as seen on the screen above. In addition, there are 3 modalities for guiding nursing care. There's preservation and maintenance of that person's culture, accommodation and negotiation, meaning that you're accommodating the healthcare to their personal needs, and repatterning and restructuring that healthcare to accommodate and to help their healing process. It is through these principles that nurses should be non-judgmental and shouldn't tell patients that their way is the wrong way simply because it is different from the nurses. You may be asking yourself, how does this theory connect all of the key terms of a theory? Through a nurse's ability to learn about a patient's culture, they will have a better understanding of the patient as a whole, including different pain perceptions and alternative traditional healing therapies that may help that patient with their healthcare outcomes, and they may incorporate those into their healthcare plan. As a result, patients feel accepted by and accommodated to by their healthcare providers. In turn, this cultural acceptance creates a better healing environment and optimizes that patient's health outcome. This nursing research can be seen, and this nursing theory can be seen in nursing research, as it was analyzed in a 2016 study, which evaluated the self-efficacy of nurses in 3 general hospitals in China. This research consisted of a cross-sectional study of over 1,100 nurses, which concluded that nurses of longer experience had higher self-efficacy scores than less experienced nurses who scored very low. The staff who were analyzed in this study concluded that transcultural self-efficacy can be improved via in-service education systems, and that it should be incorporated into their employment. This study was based on the transcultural care model and the nurse's ability to provide culturally competent care. Implementation of the transcultural care model can be seen in the care of patients as well. I personally saw it in the care of a woman of Asian descent. Upon assessment of this woman, and when we asked her about her pain, she denied having any. However, her actions, including wincing and withdrawal, showed otherwise. And upon further assessment and research, we learned that it's not uncommon in Asian culture to not verbally express complaints of pain. In order to accommodate, we offered the Wong-Baker Faces Scale, as seen above, as a visual tool to assess pain, and as a result, we treated with medication based on the nonverbal pain cues, as well as her scores on the pain scale. Due to this cultural understanding and accommodation, both providers and the patient were satisfied with pain management and holistic care. In conclusion, I want to leave you with a quote. Nursing is in a unique and enviable position to demonstrate quality care based on in-depth knowledge about the meaning and experiences related to healing clients and providing effective health care, promotion, services to the well, sick, disabled, or dying. The use of transcultural care is essential for accurate and reliable health care, and therefore should be incorporated into nursing care worldwide. These are my references, and thank you for your time.